Abortion, a comprehensive assessment of consequences and impact. Abortion, induced termination of pregnancy, is a medical intervention that carries profound and multifaceted consequences, affecting not only a woman's physical health but also her psycho-emotional state, as well as her social and interpersonal relationships. Physical risks and consequences. Despite the safety of modern procedures, the risks of complications remain, especially when terminating a first pregnancy. 1. Immediate risks, during and right after the procedure. Hemorrhage, bleeding, can be either minor or heavy, potentially requiring a blood transfusion. Infections, inflammatory processes in the uterus, endometritis, and adnexa, fallopian tubes and ovaries, which can lead to chronic diseases. Trauma and perforation, damage to the cervix, perforation of the uterine wall with surgical instruments, sometimes requiring emergency surgery and potentially affecting adjacent organs. Anesthesia complications, risks associated with anesthesia, headache, nausea, temporary loss of consciousness, allergic reactions. Incomplete abortion, incomplete removal of fetal tissue, requiring a repeat procedure, curettage. 2. Long-term consequences. Infertility. This is one of the most serious long-term consequences. The risk of infertility increases due to chronic inflammatory processes, following infections, and the formation of scars/adhesions in the uterus and fallopian tubes. According to some studies, the risk of infertility after abortion can reach 15 to 20%, especially after the termination of a first pregnancy. Problems with future pregnancies. Miscarriage and preterm birth, linked to traumatic damage to the cervix and the development of cervical insufficiency. Ectopic pregnancy, due to blockages in the fallopian tubes. Hormonal disturbances, a sharp imbalance in hormone levels, which can lead to menstrual cycle disorders, diseases of the mammary glands, endometriosis, and uterine fibroids. Oncological risks. Some studies discuss a potential increase in the risk of developing ovarian, uterine, and breast cancer, although this connection remains a subject of scientific debate. Psychological and emotional consequences. The psychological reactions to abortion can be unpredictable and long-lasting. The complex of these experiences is often referred to as post-abortion syndrome, PAS, although this is not an official diagnosis. Emotional swings. Initial relief is often replaced by deep feelings of guilt, shame, regret, and grief for the unborn child. Depressive and anxious states. An increased risk of developing clinical depression, panic attacks, chronic anxiety and insomnia, as well as psychosomatic disorders, headaches, heart pain. Post-traumatic stress, PTSD. Intrusive memories of the procedure, nightmares, avoidance of places and situations related to pregnancy or children. Self-esteem issues. Significant reduction in self-esteem, feelings of inferiority, self-aggression. Destructive coping mechanisms. The use of alcohol, drugs, or risky behavior as a way to numb the pain. Attitude towards children. Painful attention to pregnant women or small children. Fear of divine punishment. Or, conversely, attempts to atone for guilt by having a subsequent child. Impact on relationships and society. Abortion leaves a mark on interpersonal relationships and the structure of the family. Partner relationships. The decision to have an abortion can be a serious test. Mutual resentment, disappointment, and loss of trust often arise, leading to relationship breakdown. Even if the couple stays together, sexual indifference or difficulty finding pleasure can become a long-term problem. Men also experience loss, feelings of helplessness, and guilt. It is important for them to be allowed to grieve to prevent emotional distance in the couple. Society. Abortion affects the demographic situation and indirectly increases the prevalence of gynecological diseases in the population. Conclusion. Life, before and after. Abortion is an event that requires time for processing and healing. It leads to the necessity of reevaluating personal values, morality, and reproductive health. The best prevention for all negative consequences is preventing unwanted pregnancy through reliable contraception and conscious family planning. If an abortion does occur, support and psychotherapy are critically important for processing the emotional trauma and minimizing long-term effects.